Hi everyone, I'm Lynette Wetherington, and today I'll be giving you a presentation on the controversial treatment of relationship development intervention. Just an overview of what we will be discussing is we will talk about what RDI is and review a brief study on RDI, and then discuss the proponents and criticisms based on research and the study that we will be reviewing. So a little bit about RDI. It was derived by Stephen Gustine. He is a doctor in clinical psychology. He had an interest in autism spectrum disorder and the social emotional interactions that the individuals have with others. It is a family-centered treatment, meaning that the parents and the caregivers are the primary therapists of this intervention. It focuses on social emotional development of the individual to help improve the relationship between that individual and his or her caregivers. The purpose of this presentation is to discuss the proponents and criticisms of RDI based on the study that we will briefly review and the criticisms and proponents of others that have reviewed RDI as well. The RDI approach is termed as dynamic intelligence. It is an intensive intervention. It works on a step-by-step approach, gradually up to the ultimate goal. Again, it's objective driven. It involves parental training, as again, the parents and the caregivers are the primary therapists of this intervention. The approach is to improve the overall quality of life for the individual and their families, for the individual and the caregivers to understand the different perspectives that they may have, to increase the quality of interaction between them. Also, to increase the ability of the individual to cope with changes and adapt to different social situations, and to integrate information from multiple sources. There are 6 objectives of RDI, first being emotional referencing. This involves being able to be receptive and provide feedback regarding others' emotions. Individuals diagnosed with ASD may have a skill deficit in recognizing or expressing emotions. And then the next objective is social coordination, which involves ongoing social referencing, self-efficacy, and sharing personal experiences and social interactions. Declarative language involves the caregiver learning to speak slowly, simplify their language, and not to over talk, and using prompting techniques when interacting and conversating with the individual. Flexible thinking involves the change and adaptation and transition in social situations. And then the last 2 objectives are relational information processing, foresight, and hindsight. So the study that we will briefly review was conducted by Gustine himself. The participants were 16 children aging from the ages 20 months to 8 years old. They all were diagnosed with ASD. They were high functioning. And even though they were diagnosed with ASD, some participants did have other underlying diagnoses. The male to female ratio was 15:1. Some participants also had prior treatments or exposure to RDI, and they all had different educational placements as well. The evaluations conducted prior to the study were ADOS, ADIR component, a flexibility interview, and an educational placement interview as well. Now we will discuss the procedure of RDI. In this study, RDI consisted of 6 days of intensive workshops for the caregivers and parents. that focused on the theory, principles, and components of RDI. Another component of the procedure was planning. Again, it is objective driven. It is an objective driven intervention. So setting up those goals was key to success. Another component was weekly or biweekly consultation with a certified RDI consultant. These meetings consisted of discussing the progress thus far in the study, goals, future program planning, and review of video recordings between the parent and the child's social interactions. Another component was the intensive reevaluation every 6 months for up to 2 years. And then the last is the Relationship Development Assessment, RDA. This was a moment-by-moment evaluation of the video recordings between the parent and the child, and it was based on a coding system. So in the study, there were critical items that were selected from both the ADIR and the ADOS. As you can see, they all relate to social skills and emotional skills as well. There are peer relationships, range of nonverbal behavior, to name a few: conversation, facial expression, imaginary and creativity, spontaneous initiation of joint attention, shared enjoyment, to name a few. So let me just scoot my screen over here. So these were the results based on those critical items that I just showed you. On the left is pre-treatment for both assessments, and on the right is the follow-up for both assessments. The black area of the pie graph represents severe impairment. The gray area represents some impairment, and the white area represents no impairment. And as you can see, in comparison from pre-treatment to follow-up treatment, there is a substantial decrease in severe impairment in those emotional and social skills of those critical items, and there is an increase in some impairment, a substantial increase in some impairment, and no impairment. So some of the proponents, based on some research and the study that we just briefly discussed, was parent training. According to Emmons, parent training is a proponent to RDI because it teaches parents and caregivers how to improve the quality of life for the individual and for their families. It uses ABA techniques that are evidence-based, such as teaching the parents contingency management, social reinforcement, and other instructional strategies. And again, according to Gustine, involvement, parental and caregiver involvement, is the primary factor in determining the overall success of RDI for the individual. Again, they are the main therapists, the primary therapists for the intervention, and they spend the most amount of time with the individual as well. Another proponent is that once a individual reaches a developmental level, they can learn meaningful language. So with working on the social and emotional skills, it could help them reach to that level and in turn learn meaningful language. The last proponent is that it, again, increases social and emotional development. So as there were a few proponents for RDI, there are many criticisms regarding its current status. So according to Gustine, there is very limited research in RDI. And in his study, there wasn't a control group or a comparison group to compare the results of the study to. Therefore, the study was not a true scientifically based study, and the results are unreliable. Also, the sample was based on a group of individuals that were younger and were high functioning. There is a lack of generalization as to whether the intervention will be effective for those with severe ASD and in older individuals. And also considering because there was no control group in the study. Another criticism is that the families in the study were self-selected, meaning that they were motivated to participate in the study. Therefore, it may have affected the results of the study because they were eager to be involved. Whereas a family that is not aware of such deficits or their relationship with their child could be improved may not be as eager to implement and participate in the intervention or even consider RDI. Which leads to the next criticism stated by Emmons, that it could be a misleading marketing technique, as again, families may not be aware that it is a huge commitment and that they are the primary therapists. Another being related to this is the cookie cutter approach. Gustine stated that 85% of cases will learn to talk. And again, based on the study, it did not involve individuals with severe ASD or older individuals. And so it may not be the case for every individual or every client. The last criticism is parallel typical development, meaning that there may be some typical development milestones that occur that may not be due to RDI, some confounding variables. For example, in early intervention, younger individuals with ASD may develop quicker or than older individuals. Therefore, it could be the result of it could be a confounding variable in the results of RDI in the study. So again, the purpose is to discuss the proponents and criticisms of RDI based on the study and previous research. And in conclusion, I support RDI, with it being a new intervention and not many studies have been conducted to prove its effectiveness as an intervention. It's hard to say whether or not to completely rule it out. So I think with some advancements, it could be a potential an effective intervention in the field of ABA. So one thing to suggest is to conduct more individual studies and broadening that sample with including individuals that are older, diagnosed with ASD, and more severe cases of ASD as well. And it was also mentioned that RDI objectives, if they were just turned into terms of ABA language, it may be more effective as well, because it will create relatable and true operational definitions that can be measured. There is a question about qualitative and quantitative measurements to make it more reliable. And overall, it is an effort to improve the quality and life of the individual. Thank you.